Here we have a classical heat map view of gene expression on a matrix of 145 patients and 3,600 genes that have been selected for variance and expression from the TCGA colon cancer dataset. However, since the TCGA datasets enable integrated analysis of copy number, gene expression, and methylation data, we took advantage of this to cluster both genes and sample based on multidimensional molecular traits. So, reducing the level of detail, I can collapse genes to their clusters, and as you can see, we have two levels of hierarchy in which the first level is based on the methylation pattern of genes, and by unsupervised analysis we classified genes in three classes, namely methylation cluster A, B, and C. At the second level, each methylation class has been subdivided into subclusters based on expression and based on covariance of genes. So at the end we have 11 gene expression clusters that can be collapsed to 3 methylation pattern clusters. Samples have been organized in 3 levels based first on gene expression, so we have 2 major families of gene expression pattern, and then these clusters have been subdivided based on augmented dosage of copy number variation. So we have a low copy number variation class and a high copy number variation class, and at the third level we have a subdivision based on the methylation pattern. So we have subdivided samples in low methylator phenotype, intermediate methylator phenotype, and high methylator phenotype. Using the Genome Browser, we can easily navigate this by increasing or decreasing the level of detail and adjusting the column cluster level. Then we can also zoom in and out in our environment with the possibility to go to the level of the single gene detail and enabling the user to see which gene you're looking at in which sample and to see the numeric value of the gene. Moreover, we can also filter the visualized objects based on their values. And for example, here we can keep only highly overexpressed or underexpressed genes by hiding the objects with values floating around 0. And we can do this not only using the gene expression dataset, but also on a second dataset that has been preloaded into the system. And in this case, this is a methylation dataset on the same samples and genes. So we can again exclude and keep only genes that are highly hyper or hypomethylated by hiding objects that have intermediate methylation values. And now it's much more clear the rationale for classifying the genes in the 3 classes that we described before. So class A genes here, class B genes here, and class C genes here. Indeed, we can use the methylation dataset not only to filter objects, but also to see their value using the third dimension of the system. And this can be done by changing our view and by increasing the scale of the third dimension. Now, as you can see, genes not only have a color, but also have a height. And this represents the methylation of their promoter. And indeed, it's clear that hypermethylated genes, which are shown as with positive height values, appear to be mostly with downregulated in expression, while hypomethylated genes with negative values for methylation have an overexpressed phenotype. Now, if we go back to the orthogonal view, it is even more clear the rationale for classification of the patients. Indeed, as you can see here, the hypermethylation phenotype for patient is characterized essentially by hypermethylation of genes of the class A, while the intermediate methylator phenotype is characterized by medium to high methylation of genes for the class B. And this is particularly clear if we flip the vision to the negative values for methylation, and as you can see here, there are holes that are coinciding with the intermediate methylator phenotype, and that tell us that these genes are never hypermethylated in these patients.